Hello, everyone. I'm here again, Danilo Buonsenso, and as you may recall from my latest video post, we were discussing about strategies on non-pharmacological strategies on how to support a child with long COVID. So we listed a number of options. So with this episode, we will go more in details within one of them, and I will start with what a family can do to support a child with long COVID, because of course everything starts with within a family setting, and therefore this is the first step. I think it's important to agree to deal with and to dive in. And I think it's important because I've read or I've heard several families stating, telling me or discussing in interviews, I wished I knew before earlier what to do on how to support my child. So the first point is the crucial role of families in supporting their child, adolescent, or young adults with long COVID. And I think the very first point is recognizing that your child can have a real disease, which is long COVID. May seem obvious, but trust me, it is not that obvious. As many of you know, long COVID can be kind of subtle at the beginning. For some parents, children are showing a sudden and not normal changes in their physical and cognitive skills, ability, resistance to efforts. But for some other families, the changes reported by their children following a viral infection or following COVID may be less obviously linked with long COVID, maybe even because their family doctors does not recognize that the patient can have long COVID. So when you as a parent see that your child has a viral illness and since then this child is not the same as before, really you first of all should trust that when your son or girl, your daughter tells you, okay, mama, I'm struggling recognizing things, I'm struggling doing cognitive tasks, I'm not able to work anymore, I'm not able to go play football as I was doing before. Trust your child. Your child most probably, particularly if this was a previously healthy child that never showed this kind of problems, so really trust your child that your child can have a real condition going on. Luckily, most families soon recognize their children illnesses, but sometimes this does not happen. Sometimes this does not happen. I have had, particularly for young adults, like patients from 16 to 25 years old. I've had families that are not trusting their children, and they're particularly at the beginning are not trusting their child illness. Or sometimes maybe I have the mothers that do trust their children, but like sometimes fathers try to say, okay, come on, wake up, try to push yourself, don't give up, you're just tired, but do exercise and you will improve. No, trust your child, because long COVID is a real disease. It is characterized by post-successional malaise, and therefore pushing your child to doing physical or cognitive efforts will lead them to crash and suffer from post-successional malaise. We can kind of put them at bed for hours to days, and if these PAM crashes are repeated more and more times during time, in my personal experience, they can really worsen your child baseline. So support, recognize that your child may have a real disease, and support and respect the request of your child of resting. Do not push. I really believe that do not pushing your child, when your son, your daughter, when they ask you, "Mom, I'm too tired I'm not able to go to school. I wish I could, but I really feel I'm tired, mama. I'm too tired. I don't have energies to go football, or mama, yesterday I went to play sport, but really today I feel like dead, exhausted, without energies. Trust your child and respect their need of resting, because particularly during the very early phases of a post-viral illness, this can make, in my personal experience, this is not evidence-based, but it's only personal experience, this can make a really a huge whole of difference in what will happen in the chances of recovery during the following days. So recognize, support, and respect the need of rest of your children is the very first step, which will be a key point for all the following months or years and in your journey of recovery. But this is not enough, as you will be, at least at the beginning, one of the few person supporting your child journey with long COVID. You as a family, unfortunately, will bear the huge weight of fighting for the recognition of your child. This long COVID is, as I always say, is a bug within national health system, because it's a disease affecting millions of people, but a disease that is not even coded. It does not formally exist within every national health system. So this means that you have to fight for the recognition of your child disease, of your child long COVID. So speak out, speak with local media, with journalists. If you have contacts within healthcare systems or politics, speak out. Don't be afraid. Don't be ashamed of speaking out of your child illness, because only in this way you, first of all, will get some chances to have your child trusted and enter some research or facilities or healthcare center. And this is important because nowadays we know a lot more about long COVID compared to 2020 or 2021. And this means that we can investigate some problems ongoing in your child. We know that primary level tests are usually normal in children with long COVID, and these are also important because it's important to exclude other diagnoses. But now we know that children can have some abnormalities documented through, for example, postural orthostatic tachycardia syndrome with a 10-minute stand test, with a 24 hours electrocardiogram with heart rate variability, little resistance to efforts, and post-exertional malaise can be measured with a 1 or 2 days cardiopulmonary exercise testing. When there are severe neurocognitive problems, brain PET can document brain hypometabolism. Autoimmunity sometimes can be documented in some research facilities. You can measure proteomic studies showing ongoing inflammation. So this test, some patients can have small fiber neuropathy. At least these abnormalities can all be documented. And I think, although we don't know exactly how to treat these problems, or at least some, investigating this kind of damage is important, because it is true that today in February 2025, long COVID is not a formally recognized disease by insurances and national healthcare systems, but one day it will become. And having this kind of documentation will be important one day, to have a disability support, a disability recognition, a disability insurance. I'm not saying that your child is disabled and will be like that, but unfortunately, there are some children or young adults that are not able to go to school, to continue university, to work. And hopefully, this will only last some months or years, but sometimes some patients are suffering since 4 to 5 years. And having this kind of social support, even economic support through a disability recognition, every country has different systems, so I don't know how to exactly call that, but having this kind of disability insurance, disability recognition, can also give economic support to the patient and the family, because the family will need tools to support, because sometimes we have families that and parents that needed to quit their jobs to support their children. And this means also, I will talk about that in another point, in another video. Your child will need a lot of support from your local schools and from his social environment, like friends. So don't be ashamed as a parent. Speak out about your condition, even with your school, with your teachers, and with the families of your child best friends, because having a social support will be very important, and I will tell why in another video. As I said, your child's life with long COVID will be different life. Your children may struggle to work too much, and this means that sometimes they remain at home, they lose social life. So, trying strategies to support your child, be going out more and more, meeting some people, doing some activities in the open air, some excursions is important. And this, while it is true they don't are not able to work too much, the most severe patients at least, some tools like having wheelchairs, for example, can be very useful sometimes to keep their mental health and social interactions and social activities. So, for those families not having enough income, those disability insurance I mentioned before can help you providing these tools. But also, you as a family, try to encourage your child that this is normal. This can happen with any other disease. This may be not permanent, but for a while. But this can be important to keep social interaction. So encourage to not be ashamed to use these tools that can support your child keeping some activities, like going out and seeing friends, going to see the football team matches of your child teams, and so on. And another point, in my opinion, as a family, this is again not entirely evidence based, but I think all of doctors dealing with long COVID and post-viral chronic fatigue syndromes knows that these patients has a particular susceptibility to viral infections. This means that when usually most of the time when patients with long COVID meet another virus, particularly COVID, but not only, they can have a worsening of their baseline condition. So you as a family, I'm not saying avoid every social contact because life goes on. Unfortunately, the society has not dealt with reducing as much as possible viral circulations, but you as a family can do some little efforts. I will talk about that more in detail in another video, but you as a families, as adults, can try to minimize your risk of having viral infections and therefore bringing viruses at home, while how being as much as possible updated with vaccinations. I don't mean only COVID, but seasonal flu vaccinations and other vaccinations. If you meet people who has respiratory symptoms, you can ask the others and use yourself masks in specific closed environments. There are I will talk about air purifiers in another meeting. So even trying to have your social habits as much as possible in line with minimizing. I know there is no zero risk of getting a viral infection, but try to reduce as possible, and therefore bringing home as less as possible viral infections. I think it is another important strategy. So recognize your child, respect your child needs. Don't push too much your child. When your child is too tired, respect his needs or her needs of resting, because nowadays resting is the most important tool, unfortunately, until we don't find the best treatment. And speak out, awareness, fight for, contribute to awareness movements. If your country has national societies for or associations of long COVID families, being actively involved, because awareness is important. Only with strong awareness movements we will have our policymakers recognize this disease and giving us as healthcare professionals the resources to care and research for long COVID. Support your child even with tools like wheelchairs or similar tools, because your child, it is true that cannot tolerate many activities, but even staying at home 100% of the time can be detrimental, can be bad for your child physical and mental health. So try to find those activities that your child can tolerate even with wheelchairs or similar stuff, and will keep your child having his social interactions and environmental interactions and minimize the risk of infections. If you have any other ideas that you think I've missed, feel free to comment in Substack or YouTube, and I will be happy to reply or even doing new videos to further details my answers. Thank you very much and talk soon. Bye bye.